For 36 days, Kenya's public hospitals were a ghost town. This is Kenya News Update today. Coming up, you'll discover why thousands of clinical officers walked out, what finally brought them back, and the ticking time bomb they left behind. Meet George Gibore, Secretary General of the Kenya Union of Clinical Officers. For over a month, he led a strike that left patients stranded. But here's the twist. The strike is over, but the war isn't. On Wednesday, Gibore stood before the press and made a critical announcement. He confirmed that all KUCO members would immediately resume their duties. He said, "County governments must fulfill their responsibilities. When they do, we will be there to provide the necessary support." The strike is suspended. This came after signing a formal return to work agreement with the Council of Governors. The deal requires all members to report back to their stations without delay, within 24 hours. This ends a 36-day standoff that crippled healthcare services across the nation. But here's what nobody's talking about. Just hours before the agreement, union members were demonstrating peacefully outside the Ministry of Health headquarters in Upper Hill, Nairobi. They carried placards. They chanted slogans. Their grievances? Working conditions, pay, and the government's failure to implement previous agreements. The core demand was for the government to honor commitments under the collective bargaining agreement and recognize their professional status. For more than 5 weeks, this industrial action disrupted services in numerous public hospitals. Union leaders say stalled negotiations caused the prolonged strike, leaving patients without critical care. And then, something shocking happened. The government's response came from Health Cabinet Secretary Aden Duale. He previously urged the union to engage all stakeholders to broaden the scope of the current CBA. This signaled a commitment to resolve the dispute. But the question remains, is this commitment real or just another promise? With the strike now suspended, healthcare services are expected to stabilize nationwide. This brings immediate relief to patients and hospital staff, but the underlying issues are still on the table. The agreement is a return to work, not a final solution. The tension is clear. Some say the clinical officers had no choice but to strike for their rights. Others say abandoning patients was unforgivable. But if the county governments don't fulfill their responsibilities now, what happens next? The strike may be over, but the system's fragility is exposed. Do you think the clinical officers were right to strike for 36 days, or did they go too far? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that impacts your life.